Welcome back to DrDoctor and our ongoing mental health series. Please check out the previous video which covers depression, the signs and symptoms and how to diagnose. Today we focus on the management of depression, including looking at therapies and also the drug management. Let's start with some astonishing statistics on depression in the UK. More than 31 million antidepressant prescriptions were dispensed in 2006. Now that's a lot. Well, 10 years later, in 2016, this number more than doubles to over 64 million. And this is the fourth highest for any drug type. So, are antidepressants the answer? Well, as with any question, the answer is far more complex than a yes or a no. Let's explore exactly how depression should be managed based on the most current guidelines and the best available evidence. The first step in the treatment of any condition, in particular mental health, is for the doctor to be able to create a joint approach with yourself, the patient. There are some people who simply may not want treatment and may just want to keep a close eye on things. Now this is perfectly acceptable. This is something we call active monitoring. Now this is suitable from sub-threshold depression all the way up to moderate depression. And this will involve the doctor following you up closely over the weeks and months to ensure you are doing okay. Of course, the various self-help tools will all be explained to you as per the previous video, and you will be expected to take an active role in this yourself. The key elements here should be ease of access to your doctor in case your depression deteriorates. Now, for those of us who may need and want more help than this, then the doctor should firstly offer what we call low intensity psychosocial interventions. This encompasses a variety of different tools. Usually, this is cognitive behavioural therapy, often either in an online format or as some form of individual guided self-help. We will discuss this in more detail later on in the video. There will also be structured group physical activity programs designed to improve your exercise and energy levels, and also group CBT is also an option. It is important to remember that even though much of the early interventions seem like it is all down to you, with self-help, online CBT, etc., this is all done for a reason. It is shown that for those with depression who can lead their own treatment plan, their prognosis is often much better. However, there will be large numbers of people who simply cannot function well enough due to the symptoms of depression, and thus they will not be able to make full use of these self-help tools. Therefore, for those of us that do not improve despite these measures, the doctor should offer the next step in the treatment ladder. It is also important for the doctor to be aware of your history. If there is a past history of depression, or if the symptoms have persisted for a long time, then the doctor may feel it necessary to initiate drug treatment or CBT straight away. So, let's talk about cognitive behavioural therapy, otherwise known as CBT. It is one of the key interventions for depression. It is proven to be highly effective and should be available to everyone with depression in some format. Whilst low intensity is often online or computerised, high intensity is a type of talking treatment with a therapist. It is a combination of cognitive therapy, examining the things you think, and behavioural therapy, examining the things you do. And it teaches you coping skills to deal with different problems. CBT is based on the idea that the way we think about situations can affect the way we feel and behave. For example, if you interpret a situation negatively, then you might experience negative emotions as a result. And those bad feelings might then lead you to behave in a certain way. An example of this might be, if you are feeling low, for example as a result of bad news, you may then actively avoid friends and family as a result of that feeling. and as a result, you may eventually think that you are a bad friend. In turn, this only worsens your mood and leads to further isolation, and the negative cycle continues. So, what does CBT actually entail? In CBT, you work with a therapist. You identify and challenge negative thinking patterns, you identify behaviours that cause you difficulties, and you focus mainly on the present, but you may also cover relevant past experiences. You are shown practical ways on how to change these negative patterns, and a plan is made and you practice these in everyday life. And as mentioned, CBT can be delivered one-to-one, as group sessions, online, and there are even self-help books available. If delivered in a high intensity approach with a therapist, you may have between 5 and 20 sessions, usually weekly or fortnightly, with each session lasting anything from 30 to 60 minutes. It is proven to be one of the most useful strategies and has its uses in most mental health problems, not only depression. So, although therapy has a key and crucial role in the management of depression, for some, in particular those with severe forms of depression or those with recurrent forms of depression, therapy may not be enough. We therefore look towards medications, antidepressants. What are antidepressants? Well, there are a variety of different classes of medications that can be used. Selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, tricyclic antidepressants. There are a wide variety, and in essence they all seem to work by increasing levels of certain hormones in our brain. It is probably less important for us to understand exactly how they work, and probably more important to understand how they can work for you. The first and most important aspect to understand regarding antidepressants is the gradual onset of its effect. This can be anything from 2 all the way up to 6 weeks before any benefit is seen. It is therefore paramount that these medicines are given the right amount of time before deciding if they are right or wrong for yourself. It is also important to note that in some individuals, particularly those with suicidal thoughts and those in younger age groups, that there may be an increased risk of suicide in the first 2 weeks of starting. Therefore, it is crucial that the individual has enough support and should be seen by their doctor a week after commencing the medication. Another key message is the length of treatment required. If the medication is suited to you, has few side effects, and seems to be working well, then the recommendation is that treatment continues for 6 months after remission of symptoms. This greatly reduces the risk of relapse. Now remember, antidepressants are not addictive, and as long as you are taking them as prescribed by your doctor and you are not suffering any side effects, you can continue to take them for this period of time safely. Of course, as with any medication, they do carry risks. They can interact with other medications, they can cause side effects, and if you stop them suddenly, you can get discontinuation symptoms. Now, all of the above are unique to each different antidepressant tablet. Thus, it is imperative that you take these medicines as prescribed by your doctor. If you want to stop them, seek advice. If you want to change them, seek advice. There are dozens of options on the market available, and thus it is highly likely that there will be one that works for you. In summary, the treatment of depression is as shown in the stepwise approach below. Remember, depending on severity and your past history, treatments can start at step 3 or above if necessary. For those where treatment simply isn't working, having exhausted the usual management options, a referral to a psychiatrist may be necessary. Here, there are specialist treatment options available, including electroconvulsive therapy. For those who are actively suicidal and need urgent help, or in other special circumstances, hospital admission may be required. Many thanks for watching. Please do subscribe and stay tuned for future videos. Please leave some feedback in the comment section below, and please share this video to continue spreading awareness.